If the patient is unconscious, is there prescription for sterile items? If there is, has he bought it? If he has bought it, so patient can afford items for wound dressing. So that is about strength. Always look around the patient. What is the patient having? Or what can the patient do to solve the situation? Should be your strength that you should put down. Don't cook your care plan and take into exam hall. When you do that, you lose confidence. Eunice is saying that, sir, please, is unconscious a problem on its own? Unconscious, when you look at a patient in the ward, let me take that question quickly. When you look at a patient on the ward, we have types of patients. You can have a conscious patient, a semi-conscious, and unconscious. So I'm addressing that if a patient is unconscious, it is a problem, but what is it that I'm looking at that patient to give me that? I'm unconscious. I am bedridden due to my unconsciousness. That becomes my problem. So patient is bedridden. And I'm saying that when you are dealing with an unconscious patient, you should be able, or you should be guided by the strength you write. Once you start writing an unconscious, you are telling patient complains or patient can tell, it becomes wrong, because an unconscious patient cannot talk. So that's what I'm trying to clarify. So a semi-conscious patient can verbalize or can make gestures, and then a conscious can also talk. So let us know when we are writing such strength, and I believe it's very clear. Good. So that is the strength column. So your problem number one, strength number one. Number two, strength number two. It is very key because the whole front page, which I've earlier on said that it's over 6. Out of the 6, patient problems is taking 2 marks. The strength is also taking 2 marks. So if I am a candidate in exam hall, the target is to pass or get my pass mark. Once they say start work, I ask the invigilator for patient folder or chart. I get their name down, I get the diagnosis down, because sometimes the diagnosis can help me when I'm writing my problems. As soon as I'm done, leave this page for now. You can get a bed number by counting. You know the word you are on. You can quickly fill it. Come straight to the problem. What you see, 2 marks over there. 2 marks. Allergies. You ask the patient, do you have any allergies? Oh, no. So patient has no known allergy. Go straight to your strength, which is also what? 2 marks. So a candidate able to put down the name, get the problems and the strength, is already having 4 marks over 6 for the front page. 4. Routine care, that most of you waste time, is just half. The whole thing over here, half. So score your problem and your strength down, then start with your care plan, the middle portion. Is it clear? Yes. Maybe also it said, please, should it be that patient parents should correspond with the diagnosis? Exactly. So the parents are written down. When I open inside, my first nursing diagnosis should be for my first problem. You don't mix it up. So it goes in that order. So my first problem is my first nursing diagnosis. My second problem will take my second nursing diagnosis. My third, my fourth. It should be in corresponding. You don't mix it up. If you do that, you lose marks. So please, that was a very good question. The problem that you have written down in order, once it's also follow in order of the strength, it should also follow in that order for your nursing diagnosis, which we are coming to now. So as soon as I am done with my patient problems and my patient strength, then we come to the middle portion. Yes, sir, please, not the next, I mean the medical diagnosis. Medical diagnosis is just the what the doctors have said is affecting the patient. You just write that one down. It has no correspondence with the medical diagnosis. No, we are looking at nursing diagnosis. Nursing diagnosis is different from medical diagnosis. So let us get that very clear. Okay, good. Now, again, our first problem, patient has difficulty in breathing. Now, there's a document you call the NANDA. There's a document you call the NANDA. And those of you who are on our various WhatsApp platforms, I think I've dropped this document, the nursing diagnosis document on it. You can reference it when we are done with the live section and then understand more. Now, this nursing diagnosis, educate, sir, please can you use 5 minutes of the time to know the diagnosis of the patient before you proceed? Okay, so let's say the patient is suffering from malaria. Let's just use malaria. Okay, let's say that's our diagnosis, malaria. Working with malaria. Okay, so that's malaria. Good. Now, this NANDA, you see, when you go to the hospital and then the doctor takes your data and the doctor will be like, go and do labs and come. Then after everything, be like, you have malaria. It is from the assessment that the doctor has given you a medical diagnosis that what malaria. So we as nurses also, when we fish out our problem, there is a language that we should write that problem in. So NANDA is saying that our regulatory body is saying that no matter the issue with respiration, once a nurse has identified a breathing problem on a patient, write it like this. Just like the doctor was in the hospital. Oh, do you have bitterness in your mouth? Yes. Where do you stay? I stay in an area where there is choke gutters. Oh, okay. Then there's a likelihood of malaria. Are you feeling warm? Check the temperature is high. Maybe okay, go and do labs. Then when the results come, you see malaria parasite in the blood. Then the doctor will be like, oh, okay, based on all this assessment, I can say you have malaria. That malaria, it is not a doctor who forges from his mind. No. They also have medical diagnosis booklets like ours we have. So it was saying that when you look at this data, write it as malaria. That is what the medical profession have said. In the nursing profession too, when you look at the NANDA, it has headings. So when you open or the document I've sent on the platforms, you will see that when you go to cardiopulmonary or respiration, it's under headings. So something like respiration, look at respiration. So we are going and we want to look at respiration. How do we write that? Or any patient that has respiratory problem, what is NANDA saying? What is our regulatory body saying that, or how should we write it? Okay, how should we write it? So we are looking for the heading. So you can see under class 4 on your screen, class 4, respiration. Let me do it for you to see it. So respiration, class 4. Here, respiration. So under respiration, you can see them saying that impaired gas exchange on the screen. Impaired gas exchange. So our NANDA is saying that where a nurse has identified a breathing problem, no matter how you write it, when you come into the middle portion here, the nursing diagnosis column, you should write it in our language. So this patient had difficulty in breathing will now become what? Impaired gas exchange. You cannot add your own word to it. Just like the doctor said malaria, and he didn't add anything to that malaria because that's what the medical profession understands. We are also saying that when you identify a respiratory problem, you should just write what? Impaired gas exchange as your nursing diagnosis. Or when you go to the cardiopulmonary respiration side, you can see we have what? Ineffective breathing pattern. So the cardiovascular domain, you can see what? Ineffective what? Breathing pattern. So these are the two nursing diagnoses that NANDA is proposing, that once you have a respiratory problem, write it like that. You don't add your own word to it. No, you don't add your own word to it. So that is the NANDA for you. Impaired gas exchange. So somebody like maybe Belinda can be like, okay, for me, I want to write it like impaired gas exchange. That's what I'll choose. A different person can be like, okay, I'll go for ineffective breathing pattern. That is what the document is saying you should write for a breathing problem. Now, the nursing diagram is two parts. You are not done. I always tell, keep this formula. And let me put it in the comment section. Nanda, the nursing diagnosis is equal to, so I'm writing the formula for you in the nursing diagnosis. That's my formula that you can use to remember. Nanda is nursing, the Nanda, this is a formula. Problem plus strength. Sorry, problem plus related, or problem plus cause. Sorry, let me put it that way. The problem plus cause. Okay, problem plus cause. So that should be at the back of your mind. Nanda, nursing when I'm writing my nursing diagnosis, is problem plus cause. So take note of that. Problem plus cause will give you a complete Nanda. So as you have that at the back of my mind, oh, Nanda, problem plus cause, problem plus cause, problem plus cause. Good. Now, so the first part is a problem which you have already written. The impaired gas exchange, that is a problem that we have written. Remember, I said nursing diagnosis is what? Your problem plus cause is what to give you a correct nursing diagnosis. So nursing diagnosis formula is what? My problem plus cause. So with the problem is what? The problem is what? Difficulty in breathing. How do you write that problem in the nursing language? Is the first part. So problem. Okay, I said the problem is difficulty in breathing. How do we write that in our nursing language? Okay, in the document, it is either impaired gas exchange or ineffective breathing pattern. Okay, I want to take ineffective breathing pattern. Then you write one down. Then the plus you can see in the formula is what is called related to. Is it clear? It's what we call what? Related to. So you see that ineffective breathing pattern related to. So problem and a plus, I've given that side. Ineffective breathing pattern related to. Now I must add a cause to it before it becomes a complete nursing diagnosis. So again on the breathing, so I've written ineffective breathing pattern related to. So now you ask yourself, what has caused that breathing problem in the patient? And now the cause of a patient problem is left unto you, the candidate, to identify. And so I cannot give you a specific cause of somebody's breathing problems. No, we have several factors. For example, if it is pneumonia, you can say that ineffective breathing pattern related to what? You know, pneumonia is infection of the lungs. You don't just write pneumonia. Try to define the condition. So maybe ineffective breathing pattern related to what? Inflammatory process in the lungs. It's correct. Instead of you writing pneumonia, you see that you have tried to define the condition by saying out inflammatory process in the lungs. Someone can say infectious process in the lungs or infection of the lungs. You know, when pneumonia happens, there's production of too much sputum and secretion, so it can impair the airway to bring difficulty in breathing. Okay. Now, there is always a cause of a patient problem. For instance, look at this direction. A lecturer was in class and then 3 of you came to the class late. Then maybe you asked Soa or Kobe, why are you late for class today? Then Kobe was like, oh sir, because of heavy traffic on the road. So you see that Soa said he was late because there was heavy traffic. Good. Then he asked Amankwa, why are you also late? Say, honestly, me, I didn't wake up early. So you see the two things playing out over here. Soa said he was late because of traffic. Amankwa is saying that he was late because of what? He didn't wake up early. Then he asked Boame or Boame that why are you also late? And he also like, oh, say me, I didn't have money for transport, so I was waiting for one of my friends to fetch. So you will see that the three of them are all late. They all have the same problem. You and I are late. But what is causing our lateness are all different.